Best example of bipinnate muscle is rectus femoris. Inferior and superior radial ulnar joint are what type of the classification in joints? Pivot joint. Primary cartilaginous joint is formed between the ossification centers. The largest sesamoid bone is quadriceps femoris. A plane that is perpendicular to coronal and median plane is known as transverse plane. The white ramus communicant carries preganglionic parasympathetic fibers. All germ layers in a developing embryo are formed from the epiblast. The most common location for an ectopic pregnancy is in the fallopian tubes. The muscles of the limbs develop from the hypaxial mesoderm. The median umbilical ligament is derived from the allantois. A pregnant woman was prescribed thalidomide for the nausea she was experiencing. What birth defect would she be foretold? Amelia. The first meiotic division of the gamete takes place at puberty. During the fetal period in a girl's life, the process of oogenesis is arrested at what stage? Primary oocyte. The posterior circumflex humeral artery passes through the quadrangular space. If we fall an outstretched hand and the radius is fractured, then Cole's fracture occurs. Other name for Cole's fracture is Dehner fork deformity. And the root value of the nerve supply of medial side of hand is C8. Serratus anterior is innervated by the long thoracic nerve. If a claw hand deformity happens because of the ulnar nerve is damaged, paralysis of lumbricals occurs. All give blood supply to the sole of foot except the profunda femoris artery. Profunda femoris artery is present in the thigh. In the thigh region. Lateral border of leg and foot is innervated by the sural nerve. In the right foot is lifted off. If the right foot is lifted off the ground, the right side of the pelvis is supported by the gluteus medius and gluteus minimus of the left side. Which of the following ankle ligaments is injured more frequently? All except A. Posterior talofibular ligament, anterior talofibular ligament, calcaneofibular ligament. Which is a deeply placed continuation of the femoral artery opening in the distal portion of the adductor magnus muscle, popliteal artery. Y-shaped band in the front of the ankle joint is the inferior extensor retinaculum. Injury to the medial meniscus commonly occurs due to the injury to the tibial collateral ligament, or it is also called medial collateral ligament. What structure leaves an impression on the mediastinal surface of the left lung? Arch of aorta. The tubercle of the seventh rib articulates with the transverse process of the seventh vertebrae. The hiccup reflex is triggered by the irritation of the vagus and phrenic nerve, but primarily phrenic nerve is involved. Arteries in the first 6 intercostal spaces of the anterior segment of the rib cage arise from the internal thoracic artery. The pleura covering the uppermost part of the lung apical portion is called cervical pleura. The cells that are involved in the pathogenesis of a congestive heart failure are alveolar macrophages. Calluses often form the part of the skin that is subjected to constant friction. These calluses form in which layer? The stratum corneum. Basement membrane is formed by the reticular fibers or reticulin, which forms by the type of collagen fibers, type 3 collagen fibers. All 3 layers of tunica are clearly visible in medium-sized arteries. And during muscle contraction, the calcium ion binds with the troponin. Cilia have certain proteins that help them being motile. These proteins are fibronectin, and a groove or cavity containing osteoclast during the bone reabsorption is termed as Hauschipp's lacuna. What type of circulation describes the movement of bone from the heart via arteries to the periphery and back to the heart via the veins? Systemic circulation.